What I wanted to speak to you today about is the importance of really tightly controlling your blood pressure. Today your blood pressure was pretty good for most people, about 140/90. But what I want to emphasize to you is that when patients have protein in their urine, that goal needs to be much lower. And that systolic, or the top number, needs to be less than 120, and the bottom number needs to be less than 70. And the reason why that's so important is that when you control that blood pressure in somebody with protein in their urine, it dramatically changes the loss of kidney function over time. So what that really means is that if we do that simple maneuver in your daily care, we can slow the progression of your kidney function loss over time and hopefully avoid the need for you going on to dialysis. And I think you would agree with me that'd be a real win. One of the drugs that we have you on is a class of drugs called the ACE inhibitors. And these drugs are particularly important in controlling blood pressure in people with protein, really for two reasons. One is the ACE inhibitors have been shown to reduce protein all by themselves. That's one of the major powerful effects of this class of drugs. And when you combine that with their ability to lower blood pressure, they have a double effect on slowing the loss of kidney function over time. So this simple usage of this class of blood pressure medications, again called the ACE inhibitors, is invaluable to you in slowing the progression of your kidney function. As we start you on these ACE inhibitors, there are a couple things you need to know about. Approximately 20–25% of patients will develop an unusual cough. The cough is a dry cough. You don't produce any kind of sputum or things coming up out of your lungs. It's just a persistent cough. This is an unfortunate side effect of the drugs, and generally we have to change it to a different group of drugs which does not have as much of an incidence of that cough. Those drugs are typically called the ARBs, and right now we're just going to try you with the ACE inhibitor to see how well you tolerate it. Another important side effect that I would want you to contact me immediately if this happened is it can cause swelling of the lips, it can cause swelling of the tongues and tightness in the throat. This is called angioedema, very important side effect, only seen in a very small minority of patients, but a very important thing when it happens. If you ever see your lips or tongue beginning to swell, stop the ACE inhibitor immediately and call me or go to a local emergency room.